In 1980, the average American woman had about 1.8 children over her lifetime. Today, that number is about 1.6. But here is what's more revealing. In 1980, the percentage of women who said they wanted children but couldn't afford them was low. Today, it's significantly higher. Surveys show that young Americans still want an average of 2.3 children, but they expect to have only 1.8. That gap between what people want and what they expect they can afford has grown substantially. The narrative often frames this as a cultural shift, people choosing careers over family. But when you look at the actual costs of having and raising children compared to what people earn, the primary story is economic. Today, I'm going to walk you through what it cost to have and raise children in 1980 versus today, and why the same middle-class jobs that could support a family then can't support one now. Let's start by comparing what it actually cost to have a baby in 1980 versus today. Having a baby, 1980. In 1980, the average hospital cost for a normal delivery was about $1,500 to $2,000. Most people had employer-provided health insurance that covered the majority of this cost. Out-of-pocket expenses might be $200 to $500. In 1980, the average American woman had about 1.8 children over her lifetime. Today, that number is about 1.6. But here's what's more revealing. In 1980, the percentage of women who said they wanted children but couldn't afford them was low. Today, it's significantly higher. Surveys show that young Americans still want an average of 2.3 children, but they expect to have only 1.8. That gap between what people want and what they expect they can afford has grown substantially. The narrative often frames this as a cultural shift, people choosing careers over family. But when you look at the actual costs of having and raising children compared to what people earn, the primary story is economic. Today, I'm going to walk you through what it cost to have and raise children in 1980 versus today, and why the same middle-class jobs that could support a family then can't support one now. Let's start by comparing what it actually cost to have a baby in 1980 versus today. Having a baby, 1980. In 1980, the average hospital cost for a normal delivery was about $1,500 to $2,000. Most people had employer-provided health insurance that covered the majority of this cost. Out-of-pocket expenses might be $200 to $500 for copays and deductibles. The median household income in 1980 was about $17,600, so the out-of-pocket cost of having a baby was roughly 1 to 3% of annual household income, compared to 1 to 3% in 1980. Additionally, hospital stays are now typically 24 to 48 hours, not 3 to 5 days. Mothers are sent home much earlier while still recovering, which can increase the need for paid help or family support. The most dramatic cost difference between 1980 and today is childcare, and this fundamentally changed the economics of having children. Childcare in 1980. In 1980, formal child care centers existed but were less common. Many families relied on different arrangements. Importantly, housing costs, health care, and other expenses were low enough as a percentage of income that many families could afford to have one parent stay home with children. As we've discussed in previous videos, a single income in 1980 could cover a mortgage that was about 20% of household income, health care, food, and basic expenses. This gave families options. For families where both parents worked, childcare costs were typically about 15 to 20% of the median income, roughly $3,000 per year in markets where formal childcare was used. Childcare in 2025. Today, the average cost of full-time childcare for one child is $12,000 to $15,000 per year nationally. In urban areas, it's $20,000 to $30,000 per year. For families with 2 young children in childcare, costs can easily exceed $40,000 per year. That's 50% of the median household income of $80,000. But here's the crucial difference. Unlike 1980, most families today cannot afford to have one parent stay home because housing, health care, student loans, and other costs consume too much of a single income. 2 incomes are necessary just to cover basic expenses. This creates an impossible situation. You need two incomes to afford basic living costs, but childcare for children consumes a massive portion of the second income, sometimes making work barely financially worthwhile after childcare costs. The math that doesn't work. Let's look at a specific example. A couple where one person earns $50,000 and the other earns $40,000 for a combined $90,000 household income. They have two young children. Childcare costs $30,000 per year for two kids in many areas. After federal taxes, Social Security, Medicare, and state taxes, that $40,000 second income becomes about $30,000 take-home. The entire second income goes to childcare with nothing left over, but they still need that second income for health insurance benefits, retirement contributions, and maintaining career continuity. In 1980, that same couple could have lived on the $50,000 equivalent single income because housing was cheaper, healthcare was cheaper, they had no student loans, and childcare costs were either lower or unnecessary if one parent stayed home. Why childcare costs exploded? Childcare is labor-intensive. You need qualified adults to supervise small numbers of children. Regulations require certain adult-to-child ratios for safety. These costs can't be easily reduced through technology or efficiency gains. As wages for childcare workers increased modestly, though they're still underpaid relative to responsibility, and as regulations became more comprehensive, childcare costs increased, but family incomes didn't keep pace, making childcare unaffordable for many. Other developed countries subsidize childcare heavily. The U.S. largely doesn't, placing the full cost on individual families. Housing costs create another major barrier that didn't exist to the same degree in 1980. Housing for families in 1980. As we've covered in previous videos, a starter home in 1980 cost about 3 to 4 times annual median income. A young couple earning combined $40,000 could afford a $120,000 to $160,000 home, adjusted to modern equivalents. This meant that having children didn't necessarily require moving to more expensive housing immediately. You could raise 1 or 2 children in a modest 3-bedroom, 1-bathroom home. Monthly housing costs represented about 20% of household income, leaving room in the budget for other expenses including children. Housing for families in 2025. Today, homes cost 5 to 6 times annual median income in many markets. The same young couple would struggle to afford homes in the range they could in 1980. More significantly, rental costs have increased dramatically. A 1-bedroom apartment that might rent for $800, inflation-adjusted, in 1980 is now $1,200 to $1,800. A 2-bedroom jumps to $1,800 to $2,500. A 3-bedroom can be $2,500 to $3,500 or more in urban areas. The jump from 1-bedroom to 2-bedroom, necessary for having a child, represents $600 to $1,000 per month in additional rent. That's $7,000 to $12,000 per year just for the space to have a child. For people trying to buy, the situation is similarly challenging. As we discussed in the starter home video, entry-level homes large enough for children are increasingly difficult to find or afford. The timing problem. Many people want stable housing before having children, which makes sense, but achieving that stable housing takes much longer now than it did in 1980. In 1980, a couple in their mid-20s could realistically save for a down payment in 3 to 4 years and buy a starter home. Today, that timeline is 7 to 10 years for many people, putting them in their 30s before they achieve housing stability. Since fertility declines with age, particularly after 35, this delay compresses the window for having children and often results in having fewer children than originally desired. When you add up all the costs from birth through age 18, the numbers are substantial. The USDA estimated in 2017 that the cost of raising a child from birth to age 18 was about $233,000 for a middle-income family. Updated for inflation to 2025, that's approximately $310,000. This doesn't include college costs. This breaks down to about $17,000 per year on average, though costs are higher in early years with childcare and lower once children are in school. For a family considering having 2 children, that's $620,000 over 18 years, or about $34,000 per year for both children.
This is a massive financial commitment. For families earning $60,000 to $80,000 per year, this represents a significant portion of their total lifetime income. The calculation changes depending on income level, but even for higher income families, the costs are substantial enough to factor heavily into family size decisions. The declining birth rate has implications beyond individual family decisions. Economic implications. A sustained below-replacement birth rate means an aging population with fewer working-age people to support retirees through Social Security and Medicare. This creates fiscal challenges as the ratio of workers to retirees declines. It also affects economic growth. Population growth has historically been a driver of economic expansion. A shrinking or aging population creates different economic dynamics. Social structure changes. Communities, schools, and social services are designed around certain demographic patterns. Declining birth rates affect school enrollment, housing demand, and community structure. Extended family networks become smaller when people have fewer children and fewer siblings. This affects elder care as there are fewer adult children available to support aging parents. The international context. Many developed countries are experiencing similar birth rate declines and facing similar economic pressures. Japan and South Korea have even lower birth rates than the U.S. and are further along in dealing with the consequences. Some countries have tried pro-natalist policies, offering financial incentives for having children. Results have been mixed, with modest increases at best. This suggests that while economic factors are important, addressing them isn't simple. The question of choice. It's important to note that not everyone wants children, and that's completely valid. But the data suggests that many people are having fewer children than they want due to economic constraints rather than pure preference. When the gap between desired and actual family size grows, it indicates that external factors are constraining choice rather than expanding it. America's birth rate has dropped from 2.1 to 1.6 children per woman since 2007, driven primarily by economic factors rather than cultural shifts. The cost of having a baby runs $10,000 or more. Childcare costs $12,000 to $15,000 per year per child. Housing for families is increasingly expensive and hard to obtain. Student debt delays financial stability, and the total cost of raising a child to age 18 is over $300,000. These costs have increased dramatically, while middle-class wages have stagnated. People still want children, according to surveys, but the gap between desired family size and expected family size has grown as economic realities make having children financially challenging. This isn't about assigning blame to any particular group or system. It's about understanding how a combination of rising costs across multiple categories, from healthcare to housing to childcare, has changed the economic calculation around having children. Understanding these economic factors helps explain a major demographic shift that will shape America's future in significant ways. If you found this analysis useful, share it with someone thinking about these questions. Leave a comment about your own experience or observations, and subscribe for more videos examining how economic changes affect major life decisions. I'll see you in the next one.